My name is Amit Bishnoi. I'm consultant orthopedic and trauma surgeon with a specialty in knee surgery and revision knee. And I'm currently working at University Hospital of Leicester. That's my NHS practice. But I also have a private practice at Spire Leicester and Nuffield Leicester. Okay, I think that's a difficult one, but I guess it's a personal experience and how my career, how my life was shaped up. So I was probably influenced by my father. My father is a doctor, so he's a role model for me as well. And what I could see from very young age that he was there for his patients and he was always helping people, and that made him happy. And I thought that this can't be a wrong profession if he's happy. If, even working hard makes somebody happy, then why shouldn't you do it? And I guess moving ahead in my education, I did really enjoy science, and that pursued me to carry on taking a medical career. And once I got the place in a medical school, I became a doctor. So I guess his personal experiences and my father being a role model really influenced my decision. So orthopedics, I mean, I've had personal thing. I've broken my bone, so I could see, how somebody can make a difference to your life. And having worked for many years now in orthopedics, what I and even when I was learning orthopedics, the one thing I could see the difference is how I can make a difference to my patients. So to their independence, somebody coming in a wheelchair and then they start walking. If they are in pain all the time, helping pain, giving the patients the independence made me choose orthopedics. I can change lives. I may not be, it's not about saving lives in my profession. It's about changing life for good, I guess. And that really helped me, or that's my ethos of helping. I guess that's how I felt and chose orthopedics as my career. Again, it's happy patients. So seeing somebody happy, or when I change them from a very painful walking with a stick, and when they don't walk with a stick, and the happiness, just even a smile or a pat on the shoulder saying thank you, that makes me happy. That's the most rewarding. A smile on the patient is always rewarding, nothing more than that. I don't know, but I think it's patience, and I'm there to listen to their problems, and trying to help them out. Some people can have various other problems, so I think I'm patient, and then I try to give the information in the language what they can understand, rather than using a lot of medical jargon. So I think they do understand that. I've got feedbacks from the hospital and the patients that they do prefer that very honest kind of approach, honest and a patient approach. I think that's what they appreciate, or I assume they appreciate. So the mantra what we learn in orthopedics is first mantra as a doctor is do no harm. So that's a Hippocratic oath. So, do no harm. So if I feel that I can't help this person, or if I do something they may be in more trouble, then I won't do that. The other thing what I think in orthopedics, very particularly to joint replacement, is I try to treat the patient and not the x-rays. So yes, x-ray may be horrible, but if they are doing well, then they may not need certain procedures. And I try to be very honest with the patients when I see them. So I tell them, yes, x-ray may be showing something different, so we try our best to find a cause rather than just go by the x-rays.